Prescription drug prices in America have always been a heavy burden for millions, especially those relying on Medicare, SSI, or SSDI. On April 15th this year, a new executive order was signed promising to change all of that. But what many people don't realize is, if you don't clearly understand what's changing, you could completely miss benefits you rightfully deserve. In this video, we'll analyze exactly how this order affects you and what you need to do right now to avoid losing your benefits. If this information matters to you, please hit like, share so others can know, and subscribe to the channel to stay updated on the latest policy changes that could directly impact your life. Prescription drug price reduction, a major opportunity, but not everyone automatically benefits. On April 15th, 2025, a new executive order was signed at the White House with the goal of cutting prescription drug costs, one of the biggest burdens for seniors and those living on Social Security benefits. This order is seen as a continuation of previous efforts during former President Donald J. Trump's first term aimed at creating a more transparent, competitive, and accessible drug market for American citizens. According to official information from whitehouse.gov, the order requires the Department of Health and Human Services to implement multiple price reduction measures. One of the most notable changes is the Medicare drug price negotiation program, expanded with expectations to achieve average savings of 22% in the first year alone. Additionally, Medicare will change how it pays for prescription drugs, shifting from fixed prices to the actual prices hospitals pay, potentially reducing costs by an additional 35% compared to current rates. For expensive medications like cancer treatments, the order aims to standardize payment rates nationwide, giving patients access to drugs at prices up to 60% lower, regardless of where they receive treatment. However, what's most important is not everyone will automatically benefit from these advantages, and this is something many people misunderstand or haven't been fully informed about. If you're receiving Medicare, especially Part B or D, you may be in the group eligible for discounts depending on your medications and where you receive medical services. People receiving SSI or SSD may also benefit, especially if you have chronic illness records, use long-term medications, and have limited income. Additionally, the order also targets support for uninsured individuals in low-income groups, who are typically the most overlooked in previous programs. A prime example is the new insulin policy, with prices reduced to just $0.03 plus a small administrative fee. But this price doesn't apply to everyone, mainly targeting those without insurance or participating in low-income assistance programs. Why are drug prices so high, and what's really being changed? Many people have wondered, why can the same medication have such drastically different prices between hospitals, between those with and without insurance, or between different states? The answer lies in a truth few notice. The prescription drug market in America has long lacked transparency. For many years, drug prices haven't been determined solely by manufacturers, but also influenced by intermediaries, such as pharmacy benefit managers, PBMs. They stand between doctors, pharmacies, and pharmaceutical companies, and typically don't disclose their fees or how discounts are allocated. This makes it difficult for consumers, whether patients, doctors, or employers, to know exactly how much they're paying for a dose of medication. The April 15th, 2025 executive order doesn't just stop at reducing insulin or cancer drug prices. One of the more important but less discussed points is the effort to bring transparency to the entire value chain, from where drugs are manufactured to where they're distributed, and finally to consumers' hands. The administration is requiring disclosure of fees received by intermediaries. They're also requiring increased access to generic and biosimilar alternatives, which can be up to 80% cheaper than brand name drugs. This is a structural change. It doesn't just create immediate price benefits, but puts patients, not brokers, back at the center of the healthcare system. This also explains why many people might see drug prices decrease in one place, but not in another. Because this policy isn't just about price reduction, but restructuring how the pharmaceutical industry operates, and that takes time to spread. But most importantly, if you don't know what's changing, you won't be able to take advantage of the opportunity opening before you. Therefore, if you're living on Medicare, SSI, SSDI, or fall into the low-income group without health insurance, you need to check immediately whether your benefits fall within the scope of application, because not all changes come automatically, and not everyone receives clear notifications from regulatory agencies. Why are many eligible people still being missed? Paradox is quietly unfolding. Despite widely announced support programs, millions of eligible people never receive any benefits. Not because they don't need them, but because they're buried under too many procedures, fragmented information, and system silence. Many elderly people, people with disabilities, those living alone, or those unfamiliar with technology, all belong to groups easily falling through the safety net. Some don't know they're on Medicare Part D. Others don't understand that discount programs don't come automatically, and many people assume if there's something they'll send me a letter, when in reality they don't. According to data from Government Accountability Office (GAO) reports, up to 1/5 of Medicare recipients don't read or ignore notification letters because they don't recognize them as official communications from federal agencies. Meanwhile, people living in states with slow program implementation or lacking local support almost completely lack knowledge about how to verify their information. Therefore, insufficient information is never a valid reason to lose benefits, but unfortunately, it's the most common reason. Common misunderstandings that could make you lose benefits without knowing. Although the new order is opening unprecedented opportunities for drug price reductions, there's a reality few discuss. Many eligible people have missed benefits, not because they don't need them, but simply because they misunderstood or weren't notified in time. One of the most common misunderstandings is, I didn't see a notification letter, so I must not be eligible. In reality, in previous SSA or Medicare campaigns, there have been many cases where eligible people didn't receive notification letters because addresses weren't updated, mail was sent incorrectly, or they simply thought it was junk mail and ignored it. According to analysis from GAO, Government Accountability Office, reports in a similar campaign in 2023, up to 22% of Medicare recipients didn't read instruction letters because they didn't recognize them as official government documents. Another misunderstanding is, I don't use insulin, so this probably doesn't relate to me. This is also incorrect. Although insulin is the highlight mentioned frequently in media, with prices reduced to just $0.03 under the new order. This is only a small part of the entire program. Cancer treatment drugs, biosimilars, and many other specialty medications are also on the list for price renegotiation, with reductions from 22% to 60% depending on type. Therefore, if you're using any medication covered by Medicare, you could very well be part of this policy, even if you've never used insulin. Something particularly concerning many seniors is, I don't have internet, am I being left behind? Number. In all official support programs, the government still maintains traditional communication channels like telephone hotlines, postal mail, or local support centers. However, if you don't proactively update your personal information or don't ask questions at your healthcare provider, the possibility of being overlooked can still happen. Many people have lost benefits just because of such small details, not updating addresses, not opening mail, or not asking their doctor or pharmacy. That's why understanding clearly and acting promptly isn't just important. It's sometimes what determines whether you receive support or not. What should you do right now to avoid missing benefits? With an executive order that could impact millions of people like this, what's important isn't just knowing it exists, but knowing exactly where you stand in the system and whether you're in the group eligible for benefits. The first thing you should do is review all your information in your SSA account if you have one. Many people haven't been updated about new programs simply because their address, phone number, or Medicare status information in their file is no longer accurate. Updating doesn't take much time, but can determine whether you receive official notifications from SSA or Medicare. Next, if you're receiving Medicare Part D, the prescription drug coverage program, clearly identify whether you're on the list for discounts under the new adjustment. Some benefits will be updated automatically, but others require information verification through your pharmacy, treating physician, or local benefits agency. In some cases, you might not see any changes, not because you're ineligible, but because where you live hasn't begun implementing related programs. The order also paves the way for each state to design their own drug importation plans to reduce prices. Therefore, some regions may implement earlier than others. Don't wait until someone informs you. Be proactive in asking and verifying. If you're unsure where to start, there are 3 things you can do today to protect your benefits. First, visit ssa.gov to check or update your profile or call the support line if you don't use the internet. Second, check your Medicare file information, whether you're listed as participating in Part B or Part D, and whether you're using medications that might be eligible for price negotiation. Finally, ask directly at the pharmacy where you regularly buy medication. They're often the first to receive notifications about new discount programs and can help confirm where you stand in the system. Taking action today doesn't just help you save costs, it's how you reclaim control in managing your own healthcare. There's something no one clearly states, but everyone feels. The system doesn't always proactively protect you. With too many policies, too much paperwork, and too little clear guidance, many people have been left behind. Not because they didn't try, but because they didn't know where to start. If you've ever felt forgotten, felt helpless when receiving a letter you don't understand, or sat in front of a computer not knowing what to click, you're not alone. And that doesn't mean you have no more chances. That's why learning and acting today is a way to stand up for your own rights. It's not just about medication money. It's about fairness, respect, and confirming that you still have a voice in this system. And if this matters to you, don't stop at one video, because this isn't the only policy that will affect you this year. From changes in Medicare, SSI policies, to new adjustments from the Social Security Administration, all could directly impact your income, health, and life month by month, year by year. Hit subscribe to not miss any information that could help you maintain your benefits and live more proactively in an ever-changing system, because sometimes just knowing one step ahead means you're already protecting the future for yourself and your loved ones.